Welcome to the Vet Nurse Confessions podcast. This is episode 5 and we are in the studio with one of my best friends and vet nurse, Lily Pappas.
Oh my goodness. I don't know how I've been dragged along into this with you, but
Roped along.
I'm here.
So I'm not doing this on my own.
Yeah.
I'm too nervous. I would usually do this laying down in my bed like a vegetable. So this is nerve-wracking for us, but we're just going to see how we go. I'm not a performer, you're a performer. So if you want to sing a song.
Yeah. Just break out in song instead.
Yeah.
This is nerve-wracking for me too, sitting here. I don't like to talk, but you know what? We talk all the time. When we haven't got cameras and microphones in front of us, but I suppose we'll just deep dive into it.
So I met Lily, 3 years ago?
Yeah,
Lily
about that.
Stumbled along into my life.
More like a car crash into your life, I feel like. Or awkwardly stumbled in there, just like, what am I doing here? Don't know.
And never left. So I don't know what I was managing a clinic and you were working at a clinic and left that clinic, just a bit of burnout, bit of compassion fatigue, kind of at your wits of the vet industry.
Yeah.
Because how long had you been nursing for at that stage?
I think I was 8 years into nursing at that point, and it was just, I was just in a position where I was like, because, you know, we just touched on it then, I'm a musician as well as a vet nurse, and
so
was
she's going to sing a song.
Yeah, later. Yeah, maybe on another episode.
Sing a song.
Oh, look out. Yeah, I was doing my music and vet nursing, trying to balance both of them, and was just in this position where I was just like constantly feeling burnout, and I thought that, you know, I thought I wanted to leave the industry completely because I was like, I just don't know if I can do this anymore. It's so stressful. It was really starting to impact my mental health. And then one of my friends came to work with you. And on the side, like, not to be a fangirl, but like years prior, like your photos would always pop up and me and my friend would be in clinic and we were like, oh my God, like it's Tess, like she's just killing it right now. Like she's making vet nursing cool, you know, because we just felt like two little dags like hanging around.
So you're obsessed with me?
Yeah. So are you obsessed with me? Just a little bit,
so.
You know. And so she left first and came to work with you. And then she was like, look, I know you're wanting to leave vet nursing, but why don't you just come along to this clinic and see how you like it? So I hopped in my car, got an interview. I reckon I mocked up the world's dodgiest resume because, like, I've never had to have a resume. I was working from, like, 18 years old at this one clinic where they just took me in. So I was like, oh, my God, what do I even put on this? I'm pretty sure what might have impressed you was the fact that I like tequila, and you were like, this is the girl for me. She loves tequila.
I was like,
perfect.
Come in. I don't even remember your interview. Did you have one?
Yeah. I came in, it was just before Christmas, and we did an interview, and I was so nervous because it was like my first proper interview that I'd ever done.
Yeah.
And I was just like, oh my God, I'm like I'm going for a job. This feels like so adult of me at 25 years old, so adult, you know? And I'm like, okay, let's do it. Did my interview, and you text me back that later being like, yep, we'd love to offer you the position. And I was like, all right, I'm in. And I remember walking through the doors like to meet you, and it was just like, and stepping into a new clinic because I'd been at my other clinic for, 8 years pretty much. And I was just like, oh, this is so refreshing. And seeing how like motivated you were and meeting all of the girls there would just made me feel like, okay, maybe I don't need to stop vet nursing. I just need to go and try something a bit different and also like expand my skill set. So that was how I came crashing into your life. And then I've just stuck around ever since.
And it was such a nice, like, modern clinic. And, like, everyone all the staff were, like, fresh and just kind of excited. And we had, like, a really good team.
It was such a good team.
It was such a fun team. Like, not only would we work every day, and then we would all go out on the weekend.
Yeah, on the weekends.
So then there'd be the drama and the gossip from the weekend on the Monday morning, which did actually cause a bit of drama here and there.
But good,
but
though.
It was so fun. And, like, I do remember that you coming on board, I was so excited because you had the experience, which is really, really hard to find. And you were just pleasant to kind of be around, just like friendly and just like bubbly. And I also liked as well, because I've been so strong-minded on making it that vet nurses aren't just vet nurses. We are so capable. You came in and said, hey, I still want to do vet nursing, but also I'm this I am a musician. I want to do music on the side. And I was like, that is awesome. Like, I love it when girls, vet nurses, want to do that stuff. I push for that stuff because vet nursing can kind of suck the life out of you at times.
Yeah.
I think having stuff on the side is so important so that you can like balance it.
Yeah.
And then you kind of came in and said, I still want to be able to do this on the side. Can my shifts be flexible? And it was just the whole transparency that made it like such an easy kind of decision for you.
Yeah.
But then I think I've definitely had like a soft spot for you, and like other nurses would comment on that.
Yeah, I know. And it's been something that I'm very aware of in my life, but I've always tried to be as like transparent as possible, because I feel like you can get in this position where you're overcommitting your time to something and then you end up letting people down. And at the end of the day, I'm also a people pleaser. I hate letting people down.
And you feel guilty. Like you feel like,
you feel guilty.
But
and
then
like,
you kind of miss out on
the opportunities.
enjoying your life.
Yeah. And I feel like, I'm 27. I feel like I'm still an old lady.
Quite elderly.
We can touch on that after. Quite elderly, yes, with all my issues. But no, I feel like I always wanted that to be, and I feel like that's something that my parents also taught me as well, is that you've got to have that work-life balance. Yeah. And my music is still my career, and so is my vet nursing. It's just been trying to bridge the gap together. And I'm aware that, to a lot of other people where that's, 110% their life is vet nursing or their life is being in the veterinary industry. If that's what they've wanted to do their whole time, like, obviously that's their dedication. But I feel like it's so healthy to have something on the side that just keeps you grounded. It helps you balance your life a bit better. So for me, I've found a really good balance now and I'm lucky enough to have 2 career paths as well, like what you've got as well, with making your vet nursing a business as well, that you're able to work, you go to work and you're happier at work. And you're able to do what you also love as well. Like for me, that's always been music and vet nursing. Since I was a little kid, like the 2 things all I wanted to do in life was vet nursing and music. And I'm doing both of them now. And I feel like I'm in such a better headspace doing it, which is great. Especially after meeting you too. Like I remember walking in, and the more I worked with you, it was just like so inspiring to see somebody taking vet nursing to that next level, because it's always been so, I don't know if you found the same thing when you were in there, like it's always been capped at a certain level. Like you can only really go, you step up into practice management and then there's not much further you can go.
There's kind of nothing.
Yeah.
And you're kind of capped at, and like unfortunately, and it's kind of definitely changing, we're pushing for that. It's not just you're just a vet nurse, stay in your lane.
Yeah.
It's so much more than that. We were talking about this earlier, that it's kind of drilled into you from school and like coming into vet nursing. You said it perfectly, like vet nursing is kind of pushed off as, if you're not smart enough to be a vet, if you're not kind of getting those grades, or maybe you should just do vet nursing, when it's a huge career and it's just not taken as seriously enough.
Yeah.
And like, it's not like, I just find that there's all these people doing the course going on, even if it's online or it's at a TAFE, and there's kind of no prerequisites to get into the course. So therefore you kind of just get he, she, friggin' everyone signing up for the course. And what happens is these TAFE courses, might have like 75 people starting off the course at the start of the year.
Yep.
And they think, yeah, great, we're going to have 75 new vet nurses going off into the field at the end of the year. But I think it's probably like... Can I speak?
That V was a bad idea beforehand.
Yeah, too much caffeine. I'm
jittery.
More than half of those students drop out. Because it is harder than what it's kind of sold to you when you're signing up for the course.
100%.
It's friggin' hard.
It is so hard.
I remember a nurse we were working with, she had her class. There were so many students in it, and at the end of it, there was like 10.
Yeah.
And then lots of nurses, they'll do it for a couple of years, get out into because these courses now are like a year long. They're not long enough for people to just kind of like rope their head around the knowledge that you have to take in. They get out into the field and they're working in a clinic, and then it's tough.
Yeah.
As it's stuff that you see in those first 2 years that you've never been experienced before.
Yes.
It's traumatic that you kind of go, oh my gosh, this is petrifying. This is not for me. I'm going to leave.
Yeah.
But it's just, we were talking about, it's this hump of like, the first, I think I called it in another podcast. It was like the 2-year blues.
Yeah, you spoke about that in your first
yeah.
podcast, and that hit home.
It's so relevant because you kind of get, I remember going home crying, like just getting in, final day and then get in the car and just drive home crying about like a dog that, you know, had passed away, and just, you're just not used to that kind of trauma when you've just kind of come out of school, out of high school.
Exactly.
And then so people leave and they drop out. So then we've got less and less and less and less nurses staying in the field. Whereas if you just kind of hang out and stay in the field for a little bit longer, you kind of move over that hump, and then it's kind of smooth sailing from there. And that's when you kind of enjoy it. And that's where I find it was after that hump for me that I moved into like a management role. And that's when I kind of was like, oh, this is so good. And I kind of got to really kind of fill the shoes. And then I was like, this is not just vet nurses aren't just cleaning cages. They're not just, and that is a big stigma about it as well. Like, and lots of people, which really, really irritates me, they'll go on social media and say, we just glamorize cleaners. I'm like, no, you're not. No, you're not. Like you don't have to let that be the stigma anymore. No. It's so untrue. Like you do so much stuff in the clinic that is so much more. This is very, very small.
Yeah.
Fraction.
Tiny part. Like
of the job.
You go home and you like recount your day to your partner or to your parents, and they're just like, you do that in a day? And you don't really realize how important your job is until you talk to someone else, and they're like, oh, and they'll be like, oh, I could never do that. Like that's crazy.
Every person.
Yeah.
Oh, you're a vet. Oh God, I could never do that.
Yeah,
no,
because like
couldn't.
How do you build someone up, like talking about those traumatic experiences, like how do you prepare somebody? Like I feel like there was such, particularly with my training and a lot of other nurses that I've seen, you're not prepared. With? I did like open colleges online.
No, you didn't.
Yeah. I did.
Did you?
I did. And it was 18 months, the course.
18
so
months.
I was in clinic studying. So I first did my cert. I did my cert 2 when I was in high school, year 12. So you take like school-based traineeship, you take a day off and do it. And that was when I went into clinic, and I hated it. It was devastating because I was like, this is all I'd wanted to do, and then fell into this field, and I was like, oh my God, this is not what I thought it was going to be. And partly was because just the way that you get treated as a trainee, and I hope that changes. Like
by who?
Oh, just
what was it in the clinic that scared you, or like what? Like we need to pinpoint these things,
the areas of
so
them.
that it stops.
Yeah, by nurses and by vets. Like, and I feel like when you go in there, you're young. Like I was 16 years old when I was going in, and like, you know, there was silly little things like I didn't know how to turn a washing machine on.
Me neither. I remember like head
what?
nurse teaching me how to use the dryer and wash them. I'm like,
oh my God, whoa, that's like
this
that's
is
high tech.
This job is full
on. And then you go into, and you're like, oh my God, what is this, you know? Yeah. But yeah, I just feel like, you know, there was just this lack of, it starts from the top in my belief. Like I feel like if you've got a boss that is displaying that sort of behavior, it trickles down into the staff members, and then they treat other people who come into the clinic like that. So there was just this like really bad environment that I went into, and I would go home like crying. Like this story, we'll because we're going to touch on this later, but one of these stories, I'll never forget it. And it was like killed my confidence. Like it was a euthanasia had come in, like my first experience dealing with a euthanasia. Obviously, you know, so sad. I'm so young, don't really know, you know, how to approach the situation properly. And one of the nurses had said like, go and grab a body bag to me to go and get a bag. And I was like, what?
Bag it up.
What? Yeah. I'm like, oh my God, this dog has just died. Like, what do you mean we're putting it in a bag? So like,
it's because they're so used to it. That's just the norm.
Yeah.
So then a freshie, they're just like,
yeah, go and get the body bag. And I'm like, okay, like didn't tell me where it was, where to find it. So I've gone out there, there's no body bags. And so I'm like, okay, I'm just going to try and find,
bag it is.
I'm just going to find the closest thing. So like I go and grab, like they didn't have body bags. So I'm like, there's a garbage bag there.
No, you didn't.
Yeah. And I brought it in, and I was like, oh, I'm sorry, like there was no body bags. Not with the client around, just FYI, it was with the nurse there. But I was like,
hope not.
there was no bags. Like, I've only got this. And like, she was just like absolutely tore me a new asshole. And I was like, sent me home in tears
Yeah.
because I didn't know. Like, I know probably people listen and be like, come on, like, that's a bit stupid. But, like, if there's no other option, I'm like, well,
if you're
what do you
fresh
mean?
to it, who knows?
Yeah, how do you know what, like, I've never been in that situation before. And it was just things like that just completely, like, crushed my confidence. And I'd go home crying all the time. I was like, this is awful. And just, like, being told out the front, when you're cleaning, like, oh, well, you're the school-based trainee. So, like, you're doing all the cleaning today.
Yeah.
There's no, like, responsibility sharing. So it was just like, you do, that's where the stigma comes from, that you're a glorified cleaner because people treat you like a glorified cleaner.
And I wonder if the people like online saying we're just glorified are those people that haven't made it.
Yeah.
Not made it, but they've been in that section of vet nursing and haven't gone any further because that's all they think they're going to be. And that's not true.
No, there's so much more to the job. Like, coming to you, like, I feel like the previous clinic that I was at, and I got to a point where, you start to really get into your vet nursing. Like you said, you get over that hump and then you're like, oh, this is kind of smooth sailing now. Like, I know everything that I need to know here. And then going into a more high pressure clinic, like where you were working, and that then gets that skill base up even more, and I feel like there's a lot of these nurses now that are getting stuck in the same job or the same position where you're not learning and growing because there's nowhere to grow further from that, like we were saying. So I feel like getting out and doing different things like that really opened it up for me to be like, oh no, I still love vet nursing. This is what I want to do. And you can still learn so much from different people.
That would be like one huge piece of advice that I would always say to a junior nurse is, or even a nurse in general. If you're in one place and it's just not, it doesn't align with your values, or, you're not getting the experience you need, you're not getting to do catheters, bloods, all the stuff that like we love. Like I love a catheter. I love it for a catheter.
When it goes,
If you're not getting to do that stuff, like pack up your stuff and find another clinic. There is nothing, and lots of nurses get this. They get stuck in one clinic and they just think, oh, I just can't go to another one. I don't know. They just
that was me. That was
probably me as well. I just was like, I'm so dedicated to this clinic. I've put so much time into this clinic. You kind of get so stuck, whereas there can be a really, really great opportunity somewhere else, and there's nothing telling you that you have to stay in the same spot. And also, if you're looking for more experience, and go and do like casual shifts at like an emergency center. They're always looking for like casuals, like after hours, like Saturday, Sundays, nights. And you can do like a few like 8-hour shifts. Then you will learn and like take on so much stuff. You learn so much in such a small amount of time. Going and doing, and you could do it for like 3 months, and then just. Okay.
And also, like, working with other vets, I feel like that really expands your knowledge. And because there's, I feel like you get stuck in these patterns, particularly when you've been working with the same person for such a long time. If they're your boss, whatever, there's a certain way to do things. But we all know that there's not just one set way to do something,
And that's lots of people in vet nurses struggle with that. They go, why is every clinic so different? I don't know why, but there are just so many different ways that work for different people, and you're so right. Vets, some vets are really scary. Some vets are just really scary, and they'll kind of. It is because they are under a huge amount of pressure. Like, let's be real. Like, their job is friggin' hard, but it's not always like that. Like, you can work with people that are very kind of easygoing. Kind of, you're comfortable talking to them. You're not always nervous. You don't feel dumb.
Yes,
that's a huge thing. They feel people go, oh my god, I feel so stupid. I don't want to go to surgery with this person. I feel so stupid. They make me feel small. It just doesn't need to be like that.
It doesn't need to be like that. There's a way to make someone still feel like, still answer the question, and if you need to correct them. But there's a way to do it, and there's a way to make someone not feel like an idiot for asking the question. Because, oh my God, I couldn't count on my hand like how many dumb questions I've asked.
And you just got to ask them.
You got to ask them.
Like, I love it when people say stupid stuff. I'm like, that's amazing. Like,
your brain thought of that. Like,
and I'm like, I love that, and I'm going to remember. That's like the Anastasia. And general Anastasia. And did you know what I was thinking about? I don't think I've ever told one of the nurses, a good friend of mine, so I can say it, but she wrote, like, with patients coming, big whiteboard, and patients in for this, extra, it's in for a spay, and then it needs extra stuff extra stuff done. Can I say say that?
Yeah, do it.
Dew claw removal. JEW. Wrote it on the whiteboard. Wrote it on the whiteboard. And I remember it being there for like hours, and then I noticed, oh, what is that? Dew claw removal.
No.
And oh my gosh, she used to do always such funny stuff. Like, what else did she say? I don't know. I had a trainee nurse once, and I just love these because they're like my favorite thing ever. And like, you know, when like a wildlife gets brought in, you just write it up on the board. So like if a wildlife carer comes around and picked up.
Oh no.
Lorikeet. So a rainbow lorikeet. Lorikeet. But she wrote lorikeet. LORIKEY.
Oh no.
A lorikeet. And I remember just staring at me like, what?
Oh my goodness.
It was so good.
I love things like that.
It's not like I'm making fun of them. I just think that's hilarious. I love that. Do more of that stuff. Spice it up around here. Do funny shit.
I love how we started the like episode. We're talking about how like, you know, the vet nursing, like the teachers just kind of recommend it to the rejects. Wow, yeah.
Yeah, but
we
the
can't
rejects
spell,
are
but
fun.
you know, yeah, they're fun.
Fun.
We're incredibly talented.
Yeah.
You know, we
Singers,
singers,
professional dancer.
multifaceted women who are in your clinics these days.
Oh, that's what I was thinking about before. Like people coming into veterinary. That's why I like that you've got such a like you're passionate about your side. I keep calling it a side hustle, but it's a big deal. But
My side, it is
having
a
things
side
on the
hustle.
side, hobbies on the side, interests on the side, because when you make your whole life revolve around your job or your work, that is 100% where you're getting all of your kind of happiness from.
Yep.
That's when people do fall into that kind of like compassion fatigue, because you're not kind of sometimes, there are really hard days and it is kind of really, really draining that all of your happiness and like your kind of dopamine and stuff is coming from your job, that sometimes it's not always gonna fulfill you. That's good.
I feel like that in the last 6 months for me has been a massive thing that I've really strived for with music as well, because like that is a really tough career path, and at times it's completely unrewarding. You don't feel like you're getting anywhere. And so for me, like I went from having like, you know, I was full-time vet nursing, then I stopped and did full-time music, and then both of those drain you to a point where you're just like, I'm getting this compassion fatigue, I'm getting fatigued on this side. Whereas now having this balance of like, I find that I don't get fatigued in my vet nursing, I don't get fatigued in my music, because there's an overall balance in my life. And that I feel like is so important for other people, regardless of what you're doing in life, like with your job, with your vet nursing, having that other side, like we've touched on, that just makes your whole life and the way that you look at vet nursing just completely different. Like I would honestly say that to any nurses that are, you know, finding themselves in that position where they're like, oh God, like, you know, I've been doing this for such a long time, I don't know if I've got the love for it. Pick up a hobby. See how you feel after that. When your whole life is stuck doing this thing, it's hard to get that satisfaction back from it. And you start getting frustrated in situations. Like we were talking about this earlier, like, you know, you act out or you do things that you wouldn't normally do because you're like completely like fatigued in the role. Stress and fatigue. And that makes you unhappy in the workplace. It makes you unhappy at home. It makes you in all those aspects, and you start getting frustrated, particularly like you can talk about with animals as well. Like it's a hard job, vet nursing. And sometimes we can get frustrated at the animals, and it's like, you know, they're sick animals. They are here for our care, and we've really got to make sure that we are at all times being super compassionate in that scenario.
For their best interest.
Yeah,
not just
100%.
being one big sourpuss.
Yeah, walking around just like
hating
life.
And it goes back to as well, if you are so stressed and kind of worn so thin in clinic, you kind of lose your patience with other staff, patience, and you kind of lose your way and how actually like compassionate you are. Good off branch of that would be, we were talking about stress-free handling, and like that kind of thing is getting a lot more promotion in clinics. It's kind of getting a little bit more acknowledged, that taking your time with patients and being slower and, you know, accommodating to the patient is so much more beneficial for everyone involved, client, staff, patient as well. So if you're stressing out a patient and then it's coming back and it's even stressed, you know, the next time that it's coming in, it's just kind of stuffing you up altogether.
Yeah.
Like slowing it down. Like things happen when people are they're rushing.
Yeah.
If you're rushing, you're not taking your time, you're not calculating properly, you're not kind of having the patience with your patients and giving them the best care. Accidents happen, injuries happen, staff leave,
Yeah.
fights happen,
Yeah.
and it's just not really worth it. It does come back to clinics are so busy that they just
Yeah.
physically don't have time to kind of slow
Yeah.
down. We need to kind of revise that.
Yeah.
There are clinics popping up here, there, and everywhere.
Yeah.
It shouldn't get to the point where you're kind of getting everything in the door, get it all out the door, like it's a friggin' meat factory.
I was about to say, like, since COVID, it's been like, you know what I mean? Like, we had that period, and I feel like, I'm not sure if you noticed a massive difference after that as well. I feel like there was just a lot more time because you weren't as busy, you weren't like completely
in COVID.
Yeah, but prior to COVID, probably like there was that period where I just feel like there was a lot more time. Clinics weren't overwhelmed with the amount of animals we had, and there wasn't this mentality of like get them in, get them out. It was, we really were taking the time with patients, and that comes all into patient care, I suppose, and making sure that you're adequately staffed, you've got the appropriate amount of time allocated for consults and for nurse consults, that sort of thing. And I feel like now I'm just finding a lot of scenarios where it's just like rushing because we're always under the pump, and it's impacting the patients in my experience.
The patients and the staff. The staff just leave. Like it gets too busy.
Yeah.
And it's just not good for anyone. And if we think about it, I think it's clinic owners, they want to get everything in, see everything, whatever. But if you kind of explained to clients, look, we're at capacity today.
Yeah.
If we, squeeze your patient in, it's not going to be in their best interest. Like we're not giving them the appropriate time, what they're paying for, and your professional, because something's rushed, something's missed. It's not, they don't prefer that in their best interest. They want the best thing for their pet. Like I think that clinic owners think that they're doing it to help pet owners, but actually in the long run, no. You're stuffing yourself over, you're stuffing over your staff, and you're stuffing over your patients. Yeah. Because they're not getting the right care.
And then clients will go somewhere else because they feel like they haven't been given the time, they haven't been given the care or shown the compassion that they thought they were going to come in to get. Because most of the time when we're seeing clients, like we're seeing them because their animal is sick and they're stressed, obviously like with everything that's gone up, like cost of living's gone up, like they're feeling that pinch as well. So we're seeing them sometimes when clients are feeling at their worst as well. And our role in our jobs is to try and help the scenario. Obviously, there's scenarios where people are complete assholes and you've got to be like, well, this is a bit too much. What? Yeah. Really? In the vet industry? No way.
So nice. And then it leads on to, we've got no time, and then we're short-tempered. Yeah. And then you're villainizing the client when the client is just worried about their friggin' animal.
Yes.
I'd be the same. Like if something
100%.
happened to Daphne, I'm freaking out, and then you go and you might be out of your mind and behave a little bit differently to how you normally would. And then what we do as vet nurses, because we go, oh my God, that client is such a pain in the ass.
Yeah.
Like, doing this, not really. Like they're just not in their right state of mind. They're just worried about their animal. It's not like a kid that can tell you what hurts. It's all a bit different. And I think then it kind of forms like this, if you get like one bad egg that's kind of villainizing clients and kind of forming that stress, and it just grows and grows and grows throughout the staff as well. And so then everyone's negative. Yeah. And I think that is a huge thing in clinics, like the 100%. Negativity, people that are just kind of in a slouch, and then it kind of feeds throughout the staff. Yeah. And then everyone's negative. And there's not enough like positivity. Like what do we used to do in the clinic for positivity? Like we'd have music playing. Yeah. Well, we used to have, if you were surgery nurse for the day, you get to have the Yui Boom. You got to play. You're in control. And it was always like really good music, like on a Friday, like R&B and stuff and whatever. But do you remember? We had one nurse and she loved Screamo. Oh, do you?
Yes.
And so like it would be like a Wednesday and she would put on Screamo music and we'd all be like,
whoa, this is too much.
Wow, this is woo. This is it. She would always like she would cop so much stuff about it, like all in good like humor, but
Yeah.
she'd probably leave it on for like an hour and then she'd be like, stuff is.
Yeah.
And I always felt so bad.
If you're all going to complain about
that was
it.
just her interest. That's just what she liked. But I'm like, it's not really the positive,
It's
uplifting thing that we want around here.
It's not really like, screamos are definitely. I remember asking her, like, so why do you
Everyone
like
used
this?
to give her so much shit about it. It was so bad.
I know.
She'd get upset. I'm like, oh, like she just likes what she likes.
She likes what she likes, but we don't need to hear about like the death metal. Like, that's not bringing the vibes up, But
she was on a high.
she loved it.
She was loving
absolutely
it.
loved it. Everyone else was like, whoa.
Yeah.
No,
Great.
but it's, I feel like you need that energy in a clinic. And that's what I loved about working when I came to work with you. Because, depending on where you are in clinics and everything, like I was the youngest at that time in the clinic that I was at. And just, I didn't have anyone that I could like relate to. And I feel like that's such another like important aspect of being, of working with people that you're, like-minded with as well. It just makes the job fun. It's a hard job. Like, and you've spoken about this before, like, and probably we'll touch on it more, like the aspects of the job that are just like heartbreaking. They'll leave you in tears. You need those moments that make it worth it, that you're just like, oh, I feel good. And those come from the people that you work with and also the outcome of the cases that you work with as well. Like, you have a patient that's like, you recovering from some traumatic surgery or had been hit by a car and they end up making a full recovery, and you're just like, how satisfying. Like you've got to be a part of that healing of that animal. And those, along with having good people that you work with, just make clinic life like amazing, because it is a great job. Like, obviously we love it.
It is a great job. I know. I feel like I wish people could see how good it is. Like there's such a stigma about it, but I just think it's great.
I think it's an amazing job. Like, that's why I'm still here. It's so funny. We have this like joke at one of the clinics that I used to work at, and it would always be like, because I'd leave for my music, and then I'd be back. And then I'd go and I'd come back, and it's just like, she's like a bad smell, just keeps coming back.
She keeps coming back.
I was like, I'd like it to be referred to as a boomerang. I feel like that's a bit of a nicer term than a bad smell, but sure, like, but it is something that, it's a job that I feel like you always at some point come back to, because if you are passionate about it, you love it and you want to be around that in that environment. And that's why I keep doing it.
Yeah. And like, I don't know about you, but I don't really get it anymore. But I remember I used to always get so like, do you want to become a vet? Like, are you going to become a vet? No. And my like answer to this is a strong no. No, I don't. I don't want the responsibility. That's a hard job. And I feel like you only kind of really, really do well in that if you own a clinic.
Yeah.
If you get to that stage, which is really hard.
Really, really hard.
I just don't, I have no interest in, for one, I'm not doing the study.
Absolutely not.
There's no way. No. The only thing that I do regret, not going to uni, I do regret not going to uni.
Yeah.
Because I didn't get to go to the uni parties.
I was going to say, was it for the experience instead, not going to?
Just a university experience. I didn't get that, which is pretty sad. But, and maybe I'll still go.
Who knows what's on the cards for you next year?
What do you reckon you would have done if you didn't do vet nursing?
I honestly have no idea, because I
not
feel
music,
like,
not like if that was out.
if that was out of the
Another
question.
Profession.
I've said this to you before. I reckon a psychologist for sure.
You'd be good at that.
Yeah, just sitting down, listening to people's problems.
I feel like vet nurses always say, I'll be a dental nurse. And I'm the same. I love
really?
dentistry. Yeah, I would have loved to do dentistry.
I think that the reason that I would love psychology, though, also becomes a part of the job, because when you are like sitting there counselling people, like it's a part of the job. You're counselling people, grief counselling, like I love like sitting there just listening to people's stories and trying to help people. Like I'm a massive helper. Like that's why I do music. My motivator in life is to help people. Like when I'm writing, that's therapy for me. It's therapy for other people. When I'm at work as a vet nurse, I feel like that's my job. I'm helping people. I'm helping animals. Like I just love that helping aspect. So I feel like the sitting down, also listening to people's like totally messed up gossip.
The gossip.
Oh, the
so
gossip.
what's going? I'd love. So what's going on in your life? Tell us about all the toxic stuff.
Yes, I love it. Like when we go out to dinner and stuff, we just sit there and we talk about the most random stuff, and you're just like, you probably couldn't tell anyone else, but I feel like it's just because there's this sort of weird dynamic between us that we can tell each other our deepest, darkest secrets.
People that you just you and it's hard. It's hard as you get older to meet people that you kind of can really like open, and there's no kind of judgment. I feel like that.
Yeah, it's a no judgment relationship here, which is great.
It's intimate.
It's good though, because I feel like you've re-inspired that. Like I always say this to you, and if I don't say it enough, I'll say it more on the podcast.
Go on. Say it.
Feel like
say it.
I feel like you've not just re-inspired me with my nursing, but I hope, and I've seen it with a lot of other nurses, like you've re-inspired them because you've bridged the gap between what there was in terms of study and in clinic. Like there was this massive piece missing between when you do your study and then you just come in fresh-faced into a clinic and you're expected to know all this stuff. Like
once you've graduated your Cert 4 vet nursing, your employer, and unfortunately, they don't really understand about like vet nurse training and that. They just expect you, you're Cert 4, great, you can monitor every anaesthetic, you can monitor a neck slap, anemic patient, you're going in there. Why can't you monitor it? You're qualified. It just... Unfortunately, we need some patience in that regard, and they just kind of don't. And so that's what I tried to, like, with vet nurse school is, bridge that and help people feel the confidence in doing that stuff that you don't get a lot of training on. And it is, unfortunately it is, and I say this all the time, it just does come with time. Yep. Like, I just feel like I still, like, learn stuff about, like, blood pressure and,
forever learning.
CO2. Like, I still look up so much of this stuff. Like, I don't have lots of this just sitting in my head. Like, there's lots that I do know, but there's a lot that I don't. Yep. But it's like junior nurse. Am I yelling?
What,
I feel like I'm screaming.
No, it's good.
And they come in and they think, oh God, I should know all of this. I'm expected to know this. That's just not. No, you're not. That's not the case.
There shouldn't be that expectation that you need to know everything. Like there are so many, because we do so much in clinic, and it's crazy. Like when you actually sit down and break down what your day looks like, you're going from 1 minute doing labs to then you're going straight into surgery and you've got to monitor a full anesthetic. Like it's a completely, or you're talking to someone, a client, and you've got to really like try and talk them through something. Like there's different aspects of your brain that you're using for each thing, and you've got to store it all in there. Like I'm still forever learning. Like I'll have nurses like that are younger and they come up and they're all full of the knowledge, and you're but there's this thing that happens when you've been, and I think that's to say for the experience, like, and we talked about this quite a bit when I came to work with you. There's, you can teach and learn in this, but the job really requires a lot of experience and time to get to the point where like you have an emergency come in and you just step into that role. Like,
and you're so good at that. I specifically remember this cat that was in like cardiac arrest, and I don't know what I was doing, floundering around, and I was there and you came out and you just kind of said, and this was like a head vet there as well, and you just kind of said all this stuff, and I was like, and I remember the vet being like, I remember the vet being like, yeah, probably should do. And I remember being like, go off,
go off, sis.
Like, oh my God, she actually it was great.
You've hired this
and it
new
was
person.
These things that you'd it's like you doubt your knowledge until something comes up like that, and then you go, oh, actually, I do know my shit.
Yeah, because it's years of experience that got you to that point. You know what I mean? Like it's with anything in life. And I feel like I'm the same. Like I'll walk around still now and I'm like, God, I feel a little bit dumb. Like I walk around, I'm like, I think I need to retouch on this, but I know as soon as like, and maybe that's just because my personality type, like I thrive in the chaos. Oh God, we're both like that. Yeah. We thrive in the chaos. Like, and there's nothing better than an emergency walking through the door and you're like, oh, I'm ready to go. Like, let's go. It's, your brain switches over and all of a sudden, all of the knowledge that you've had the past 10 years, it comes out and you're like, I know that drug dose. I know this, like, let's get into CPR. Like you just know everything. And then you sit back and you're like, oh, I just did that. How did I do that? Because if you asked me to do that right now, I'd be like, oh, and panic.
Yeah. Oh God.
And some people do, like, I feel like that's another thing that I've noticed this is totally going off topic, but we'll get back on in a sec. But with my partner and I, like,
she's steering
I'm
off.
steering off.
She's veering off.
But like, do you find when you're just able, like, because of the job, like it teaches you to think in high pressure situations? Because there's a lot of people that can't think under high, like when they're in a high pressure situation, which vet nursing, you know, most of the time we're not. But if emergency comes, that's a very high pressure situation. Like there's an animal's life at stake here. And you just switch on into this other section. Yeah. Like, I look at my partner, I'm like, you know, emergency hits the fan. What are you doing?
He could never.
He could never. Can never match that, you know? But I feel like it just gives you the skill set.
Like, he'll never see you in that.
No. And
like,
it's so sad.
Yeah, they just would never
They never get to see that.
How cool you are.
How cool. Talking ourselves up here. But you do. It's rewarding. You get it at the end of that and you're like, I just did that. Like that's all of that knowledge coming out. It's amazing.
Can I tell you something that do you know what? I've never told anyone this and I've felt so guilty about this for probably maybe like 8 years. I remember just coming. It's a trauma dump. No, I remember, I'll never forget this, and I felt so bad about it ever since. I remember this is when I'd kind of come over that hump of feeling, I was feeling confident in my nursing, I was feeling good. And a phone call came through at the clinic, and a nurse came out the back, she said, "Oh, we've got an emergency coming down, it's hit by a car." And I remember being like, yes, an emergency. Yeah. And I was like, yes, this is, it had been like a quiet day or something, and I was like, yeah, this is good. And the patient like passed away on the way to the clinic. Aww. And I have kicked myself ever since thinking that I was excited for the and then I'm like, oh, but it died.
It died.
It was awful. And I just think like, oh, it's so like,
I know, because like you get
mind, like,
because you thrive on that pressure situation.
Exactly that. I was
because
like,
the chaos.
Yes, something exciting. And then I was like, oh my God, the dog died.
Yeah.
Like, and I've always felt so, like, oh my God, that's so awful.
Yeah, I know.
Horrible person.
Thank you for that trauma dump just then.
You're welcome. Now you go.
Oh God.
What have you got?
I honestly, like, we were talking about this, we were saying like, what would be something funny to, well, like not funny, but just to talk about. Funny. It's not funny.
It's not funny, but the more that we talk about it, becomes normal for junior nurses so that they know.
They feel, they're like, okay, this is normal. And we were talking about like, what's the most, we were talking about horrifying, the worst scenario you've seen at a vet clinic. And I didn't tell you what mine was. No. But I remember, and I was probably like 3 years into my nursing, and it was just me and one of the other nurses on this day. And get this call, like hit by a car, dog coming down, really like unstable. And I'm like, okay, start getting everything ready. The dog comes down and I'll never get the image out of my mind because I just was never prepared to see this. The dog had been completely degloved. Oh no. How? And I think it must have got stuck underneath the wheel and like, I've never seen anything like that before and it'll never leave my brain. Yeah. And then trying to touch and no one could prepare me for that scenario. Like, what do I do in that instance? Because there's nothing in the textbook that shows you how to treat a degloved animal, like what you're meant to apply. Like, and I was just,
and like 3 years in, is still fresh.
So fresh. Like, and I would have still been training for my Cert 4. And unfortunately, like the injuries were awful. So it did pass away and there was just nothing that we were going to be able to do. So we tried to keep it alive until, kept it on oxygen, ended up putting it into, I suppose, like an induced coma just to make sure that it was still alive so that the people could come down, because the saddest part there is like those people want to say goodbye or they're expecting that, you know, you can do something to save their animal and there's just nothing that you can do. And the people were there and they just broke down. And I just remember being like, oh my God, like that was so confronting to firstly see that and then to have to deal with the trauma, because those poor people having to see their animal like that as well.
And that is, that
awful.
Is awful. There's nothing even for a client. Like you can't prepare for that.
No.
And I always hate that, like that, how they saw that dog will be how they remember
it.
Like, which is awful.
Yeah.
And so sad. Oh God, I remember actually cat that like drowned in a lake.
Oh.
And the cat had been missing for ages.
Yeah.
Cat drowned in a lake, and then someone had kind of like come up on the shore, and someone brought it into the clinic, and there was probably like half of this cat, like the fish had kind of got
Oh my
to it.
God.
Yeah, awful. And all the fur kind of, and the skin.
Oh, it sends
I've
shivers
never
down my
seen anything
spine.
like it before, and I was like, it just it sticks with you, and it's like, but the skin was like roast chicken.
Oh.
It was that white, like not like it was bizarre. It was just awful.
Oh my
and
God.
then the owner wanted to come down just to identify the cat,
oh.
to say that it was their cat. And you don't want to see that.
You don't want to.
You don't want to see that. That's it was awful. I remember just seeing, and that's it. That's the part that always used to get to me. It's not so much like, yes, it's horrific for the animal, but it was always the clients. Like I always would be like, oh my God, imagine being that person, right? And that's what would be like the upsetting.
Yes.
Awful, like,
yeah.
Oh my God.
And do you know,
so bad for them.
touching on that, sorry, we've gone down a bit of a deep and dark and depressing little section here, but I was going to say that, have you noticed as well, like there's some people that get this like desensitization to death? Like you've ever been in a scenario where you're doing euthanasia and there's certain types, and I remember feeling this one time where it's just like, and it's an awful feeling because you're just like, oh my God, I can't believe I'm thinking like that. Like, oh, it's just another animal dying. Like, and you start to get this like, you feel like a little bit of a robot sometimes and I remember feeling like, that's not me. Like, I'm so compassionate. Why am I feeling like that? And I've heard like other nurses say it, and you're just like, they're just so like blasé about like, you know, that's just how it is. And it's like, no, this is someone's animal that's like passing away, and that we touched on like the compassion fatigue as well. And I feel like that really plays into that, is that like, it's such a traumatic experience to go through. And when you've been through it yourself, like, you know what it's like, you feel like, you just feel awful that it's possible to get to that point where you're like, how's my brain even thinking like that?
Yeah.
And I remember being like, okay, need to take a little step back, got back into it. And then, you know, I've been fine ever since. Like, you just feel this like compassion back towards people. You're like, no, this is a really awful scenario.
Which I think is really good. I think taking the breaks is real. I think that taking yearly holidays for like a good amount of a chunk of the year is so good.
Yeah.
Like that being able to absolutely check out of your at-home life is so good.
Yeah.
I remember when Bozzy, my last dog, when we euthanized him, and like I was a wreck because he was like 4 years old. I was like, this guy's just a friggin' wee whippersnapper.
Yeah, yeah.
And I remember after that, I had this whole new view on, you know, people losing their animals. I feel like that was like a real, not it was terrible, but it was a good experience for me to be able to give that perspective to clients, and it kind of gave me this whole new like view and outlook on clients, and kind of how to talk to them and what they kind of want and what I would have wanted and what. So that was really
That's
good.
so true, because that was literally the same thing for me. Was when my family dog it was after, like, I was beforehand, didn't understand how, you know, people were feeling, and then my family dog had passed away, and being involved in that euthanasia when it's so close to home makes you feel like you understand what people are going through in that scenario. Like, it's their most loved pet, and you're just like, you have this whole new level of compassion for them, because you're like, I've felt that before.
Yeah.
I think it was when I lost my cat. Oh my God, my cat. He was the love of my life, and then had to put him to sleep, and I had none of my family around. It was that like,
So
this feels
sad,
awful.
isn't it? Yeah.
And I get a lot of like, I don't know, I feel in that scenario now that I've been through it, I'm able to be more helpful to people as well.
Yes. Absolutely.
I know what to say, how to talk to them.
What they want, and what they kind of options, definitely, the options and what they can, I totally
because it's
agree.
it's an aspect of vet nursing that I think is very difficult to talk about. It's very difficult to navigate, because everybody, their emotions are so different. They process and grieve differently as well.
We've definitely got way more to talk about, but maybe we'll have to do that in the next episode if you will come back.
She's dragging me along
Please
for
come
another
back.
one.
Because I don't want to talk to myself. It's good. I like having you here.
It's good.
Yeah.
I feel like that went very quickly.
Yeah.
We probably just rambled on about nothing.
Just absolute rambly, vet nurse rambles.
Absolute shit the
but
whole
I think
time.
it's good. I think it's good to just kind of like chat about every kind of aspect of vet nursing.
100%.
But thank you for coming.
Thank you for having me.